Hi, my name is Whitney Dano, and I am very, very excited to start my transition from LPN to RN at Genesee Community College. When I think about motivations and goals as I continue my nursing career, a few things in my life come to mind. For as long as I can remember, becoming a nurse has always been my dream. As I got older, becoming a registered nurse was always the end goal for me. A few years ago, the plan was to go to RN school. At the time, I didn't get into any of the schools I applied for, and I knew I wanted to be a nurse. I made the best decision for me at that time was to go to LPN school and do just that. It was an amazing stepping stone for me, and with many opportunities, I am very grateful to have had to get to my end goal of becoming an RN. A big motivation for me is my family and friends that have been so supportive in my education. Making them proud is an amazing feeling. A few years ago, my father was diagnosed with prostate cancer and had to be hospitalized after his operation. As I sat in the room with my dad, I watched the amazing nurses that took care of him and made me think, I want to be that good one day, and I want people to think of me the way I'm thinking of these nurses. The main goal is to graduate and pass my NCLEX, because after that, there are going to be so many opportunities to explore in the nursing field. But with every transition, there are barriers and challenges. A big one for me is I have anxiety. Even though it's under control and I know how to handle it most of the times, it is still tough. In August, I will be moving 2 hours away from my home to attend school. This also means I will be giving up my job to go to school full time, which I am very lucky to be able to do. A few characteristics that I believe I have that I can overcome these barriers are I'm very hardworking, caring, dedicated, and determined to do well. My plan is to my plan to be successful in the RN program is first to never give up. I will also use relaxation techniques when I start to get anxious and plan trips home if time allows. When it comes to schoolwork, I'll stay organized by using a planner and a calendar. I'll use study techniques from LPN school that worked for me, and I will try to get together with other students to form study groups. Even though I've only been an LPN for about 7 months now, I do feel I am ready to make this transition to become an RN. At the end of LPN school, we all went to a 2-week internship, and I requested to do mine at the orthopedic office. On my second day there, I was offered a position before I graduated or even took my boards. This is where I am now. Even though I'm young, I was lucky enough to be chosen to be sent to a registered orthopedic technician class to be able to apply casts and splints for the physicians in our office. Also, one of the providers I work for has given me many opportunities in the short time I've worked there. I've been able to observe many of his surgeries, and I was asked to go to training with him in the OR a few weeks ago. Another reason I believe I'm ready, as I said, 2 years ago I applied to 3 RN schools and didn't get into any of them. This past fall I applied to 4 schools and I got into 3 and waitlisted at 1. That alone makes me confident I am ready to make this transition to become the best RN I can be. In my time as an LPN, I haven't experienced much role blurring. At the office where I work, there are only LPNs and MAs, but when I look back to my clinical rotations, I can think of a few situations where I saw forms of role blurring between the LPNs and RNs. Once was at a nursing home, when the LPNs would go in and do assessments on the patients when the RNs weren't around, and this is the RN's responsibility. A second example from clinical is when I went to a primary care office and the triage nurse was an LPN. And I was wondering, how is an LPN doing this? And they didn't even have a registered nurse hired in the whole office. And this is out of the scope of the LPNs. So I was a little confused there. When it comes to roles and responsibilities in a nursing field, LPNs and RNs have 2 completely different roles. According to the New York State Office of Professions website, registered professional nurse is defined as diagnosing and treating human responses to actual or potential health problems through services. Licensed practical nurse is defined as performing tasks and responsibilities within the framework of case findings under the direction of a registered professional nurse, licensed physician, dentist, or other licensed healthcare professional. When I look back to my clinicals at LPN school, LPNs and RN roles were just like this. The LPN would be responsible for passing meds, except IV medications. The RN would do that, collecting data such as vital signs and reporting any changes to the RNs. Whereas the RNs would assess and analyze the patient throughout the shift, as well as administering medications through IVs and central lines, while teaching and counseling the patients as they were in the hospital. The RN would also keep track of and check on the LPNs as needed. Knowing the roles and responsibilities of a registered nurse, I am confident that I will be able to make a smooth transition from LPN to RN, and I am very excited to do so.